Welcome into HealthWise, the TV show, and I'm your host, Ralph Hipp. If you or maybe someone you know has had some major surgery, you of course know there are major steps involved in the preparation of that and the recovery. Now, the patients who choose Stormont Vail Health for colorectal and some abdominal surgeries are going through some new routines now that are leading to less pain for them and quicker recovery times. Stormont Vail Health surgeon Dr. Wale Kreis is my guest today, and he shares more about the advancements as part of Stormont Vail's great collaboration they have with the Mayo Clinic Care Network. Dr. Kreis, it's wonderful to see you.
Well,
I
thank you for
respect
having
what
me.
you do with your hands, sir. You're
Thank
an
you.
amazing doctor, and thanks for joining us on the show today.
Thank you.
Let me break the first question into two parts.
Sure.
What are the changes taking place in the colorectal surgeries that are being done here now?
Okay. Well, Ralph, thank you for having me
Our
today on
pleasure.
your show. I'm very excited to talk about the changes we're having and we're implementing for patients undergoing major abdominal surgery, specifically colon and rectal surgery. Traditionally, patients who underwent these operations used to stay in the hospital for 7 to 10 days. Their pain was usually difficult to control. We usually wait about 3 to 4 days to let them eat or drink anything, and that was the traditional approach. Recently, throughout the nation, the trend has been to implement something called Enhanced Recovery Protocol or Pathway, and its aim is to get patients on their feet faster, back to life and back to their daily activities faster, have much less pain after undergoing this major abdominal surgery. So those are the changes in a nutshell that we've been implementing in Stormont, and that's part of our collaboration with the Mayo Clinic Care Network.
I was going to ask you separately about the abdominal surgeries, and did you want to say anything specific about those, and how are the two procedures really? They are very similar, or how are they very different?
There, major colon surgery and abdominal surgery are all within the same realm of general surgery that we do. Colon surgery is specifically aimed at colon cancer as well as infection of the colon, such as diverticulitis, while abdominal surgery is more general and can involve hernia surgery, bowel surgery, stomach surgery, and other types of surgery that we're also looking into implementing.
Dr. Kreis, you'd also mentioned the enhanced recovery protocols.
Yes.
And connect that to the surgical procedure for me.
Okay, so the way we connect that, so the patient comes in to have his or her operation. This is usually something that's planned and scheduled before time. We have the patient meet with our nursing staff, with our pharmacist, make sure that all their medications are up to speed, and we make sure that we plan ahead of time how to improve their nutrition in preparation for the operation, as well as what kind of medications we want to give them before surgery in order to decrease their reliance on narcotics after surgery. And that makes a huge difference for the patient's recovery, actually.
Let's advance in the process here, Dr.
Sure.
Wale Kreis, and is it working? Are the results what you were expecting them to be?
Yes, sir. We've implemented this pathway about in 2016, so we're getting up to 2 years now. Over the past 2 years, the patients that underwent these operations under these pathways have recovered much faster. They spent almost half as much time in the hospital as traditional recovery pathway. And about 30% of our patients did not even use any narcotics after the operation. So that's a major, major change.
What are some of the other changes that are benefiting these patients?
Well, definitely, great question, thank you. What we have found to make a huge difference is once we get the patient up and ambulating or walking after the operation, they feel better, they recover faster, and their general well-being and sense of, let's go and get better is all improved. So I think that's a major part of the pathway, is getting patients up and walking after surgery.
Right. Dr. Kreis, you'd said it was about 7 to 10 days, or maybe before all these new procedures. When do you have them up and walking? And we mentioned that there are shorter recovery times for this. When are they ambulatory?
Usually they're ambulatory the day after surgery. So immediately they get to the patient unit. As soon as they're steady on their feet, the nurse will help them get up and ambulate.
Talk to me about Stormont Vail's partnership with the Mayo Clinic Care and how that seems to be working.
Perfect. This is a kind of a two-part approach. Mayo Clinic and Stormont Vail have been in collaboration for about 4 years now. The Mayo Clinic Care Network helps to serve the local communities in places like Topeka and other smaller towns with the Mayo Clinic expertise and their practices. So it makes it much easier for a provider at Stormont Vail to access the expertise and the knowledge and the know-how of Mayo Clinic. At the same time, I trained at Mayo Clinic actually, and I did my general surgery training at Mayo Clinic. So when that's
got to be a huge advantage.
Yeah, so
for the partnership as well.
So definitely. So when I came here to Stormont, I did bring some of those practices with me and try to implement those in Stormont.
Dr. Kreis, we have about a minute to go here. It's been a fascinating chat. And what does the future hold for these procedures in our partnership with the Mayo Clinic?
Great question. There's a lot of potential still for patients who are undergoing these major abdominal surgeries. The enhanced recovery pathways have become almost a standard of care throughout the country, and they're being championed by the American College of Surgeons.
We're top of the line here in Topeka.
Exactly. So we try to stay up to date with the standard of care and the practices implemented in the country. In the future, I see these pathways being implemented on patients undergoing other abdominal surgeries or other major surgeries, such as urological surgery and gynecological surgery, for example. So.
This is Dr. Wael Kreis, and Dr. Kreis, thank you for sharing. This is great information for all of our friends at home to know, our Stormont Vail partnership and the advances in abdominal and colorectal surgeries.
Thank you. Thank you for having me.
Wonderful to have you here. Hey, did you know our HealthWise monthly senior suppers, they're back at Stormont Vail now. It's the second Monday of the month from March. It'll be starting up again through November. You're invited once again. The dinner to be served at 5:15 in the evening. It's just for $5, followed by a speaker talking about a health and wellness topic. It might be Dr. Kreis sometime, who knows? And if you'd like to come to the next one, senior suppers are back. You can call 354-5225 to make your reservation. So look at that number and make your reservation and go to at least one of those and maybe all of them. Well, now we have our HealthWise TV exercise segment for you. Get warmed up and ready. We've got some fun and invigorating, some low-impact exercises for you and your family to do. Of course, as always, be sure to consult with your doctor before you start this or any exercise program.